Here we are just downtown on Main Street, Walla Walla County Health Department. We're going to talk a little bit with Nikki and get a little bit of insight on what is some of the challenges that they're dealing with now. Hey, Nikki.
Hi, David. Good to see you today.
Good to see you. Thanks for taking some time.
Air 5?
Oh, yeah, there we go.
Ha!
I like it. Thank you. Thank you so much for taking some time to meet with us. Tell us a little bit about what you're doing here at the Health Department and what is the Health Department all about?
Awesome. Well, thank you so much, David, for asking that question. I enjoy what we get to do here, and I'm good to play a small role here as the Healthy Communities Division Manager. There's a lot of amazing staff here that are doing a lot of different things in terms of our COVID response, but also we continue to do our regular services that we were already provided in a new virtual way. So we have things like WIC, we also have maternal child health, behavioral health response, we have individuals that we're working on with traffic safety even at this point. And one of the things we've been really working on in our COVID-19 response is trying to do some outreach, trying to ensure that we're getting education to the communities that are maybe underserved and may not have all the resources they need and the education materials that they would like to have regarding testing and how to help people stay well and stay safe during this time. So
that's amazing. There's a lot of things that you're doing.
There is a lot. And one thing that we really appreciate is we've had a lot of people reach out to say, hey, how can we help? Maybe it's helping us gather data. Maybe it's helping us stuff packets and get education materials together so they're all done in a really efficient way so that our staff can focus on the activities that they're planning and providing so that we're really mobile and quick on our feet to be responsive to the needs of our community. The big thing is how do you ask that question? What do you need? And there's a lot of social determinants of health that we're learning are impacted, and this shines a light on because of COVID-19. So we really do appreciate our volunteers and the people who have reached out to try and be helpful.
That's great. So what are some ways that we could help you? You mentioned stuffing packets. Really? I don't have to be a nurse. I don't have to be a doctor?
So you don't have to be a doctor. We do not have a specific requirement there. We have some paperwork because we want to make sure that we have clean driving records, etc. But we definitely are always looking at ways that we could do something unique in our response. So sometimes it's also just being a listening ear and giving us some ideas as well. We know that we don't know all of the things. This is our first, for me, it's my first pandemic. For some others, there's our team has been in other kinds of responses similar to this, but never maybe on this same scale. And so there are things that students, we've had lots of outreach on, depending on that person's interest level, we've been trying to find good ways to help connect young people to this response. So it could be that maybe they help us come up with more materials. Maybe they help us with our digital campaign. Maybe they make us take a couple minutes and think about how we could decorate some masks even. Who knows? So we really are interested in having help.
That sounds pretty creative. So what are some ways that we can keep safe or ways that we can be of help to try to make this pandemic go away quicker?
I think that you bring up a really, we want it to go away as quick as possible. We also want to learn. And so one thing I want taking away is the importance of human connection. And in this time, we've had a lot of physical distance. We've had a lot of all of us having to stay home to stay safe and healthy, but that also has some effects as well. And so I see a huge thing that we can do is reaching out to each other, reaching out to your friends, or maybe it's offering to reach out to maybe it's a church member, maybe it's a person that's at a long-term care facility, maybe it's just someone who hasn't been coming recently or someone who is missing from your class, even your virtual classroom, to make sure that that person is doing okay. Because there's a lot that we're dealing with now, and we don't have that same level of being able to do the things we used to do, so we have to find ways to stay connected. And whether it's your Zoom phone call or it's your Google Meet or whatever it is, if we can find unique ways to help empower and keep people engaged and connected, I think we can get through this a lot more healthfully. It's not just physical, it's not just the medical side of things, there's the whole person that is part of this. So
well, that's an interesting point, and thank you for reminding us of that. It seems simple, but how do you do it? It's stepping forward.
Yeah, and I think that's taking that first step. And right now, September is Suicide Prevention Month. And so one of the things we're really trying to do is help empower all of us to try and take that first step forward and reach out and say, hey, I need help, or hey, how are you doing? You seem like you've been a little bit different lately. Right now, people are kind of going through some changes, and it can, it shows itself in different ways. And so by being curious and caring, I think we can go a lot further.
I recently heard about QPR,
Mm-hmm.
and that was a really eye-opening idea for me. Just similar to CPR, but this is for what you're talking about, right?
Yes,
That's
absolutely.
Maybe tell us a little bit about QPR.
Absolutely. QPR stands for Question, Persuade, Refer, and QPR is a evidence-based training that we believe in here at the department because it is something that helps you have actionable steps to be able to ask that question in a way that really is about connecting and being willing to sit with somebody and help them get help. Because we don't do this alone and just say, here's your little card, see ya. You know, we want to be really thoughtful about, hey, I'm here and we can do this together.
That's really interesting. So it maybe would teach us tools and what to look for, how to respond.
Yes. So it is those, but it's the question's the most important thing. It's how you ask it,
Okay.
and then you can have that conversation, and persuade them to maybe look at different options, so that they can get help.
Very interesting. Well, and maybe we could offer that training.
I sure hope that you do. I think that I would love to see every clinic. I would love to see every student feel like they were empowered to be part of the solution, because there's not enough therapists in the world. We need to be able to get upline sooner to be able to help people.
Thank you, Nikki, for your time. As we process all of this, is there anything else that you'd like to share with us about how you've been inspired, or how we can continue going forward?
Thank you so much for that question. I can't tell you enough how much I appreciate the leadership of the Center for Humanitarian Engagement, like reaching out. I feel like that's just another example of partnerships. It's so cool. But if I could say anything, I would say to all you students out there, like, welcome back, be safe, follow the rules, obviously, but we need you more than ever to step up and take your creative ideas. We are getting, we've been doing this work for a while, but it's so helpful to have new ideas, fresh perspectives, so that we can get through this together. We can't do it without you. We won't be able to do it without you, because you are going to change the world. And so we need your ideas, need your thoughts, and need your feedback, because we can get through this together.